assumption is that if the prescriptions are prescribing it, then it must be necessary. As a matter of fact, as I recall, the two owners of that pill mill in Lake Worth used that as their defense. They said, we're doing nothing wrong because the doctors were writing the prescriptions, therefore it had to be necessary.
I think one of the ways that you can also differentiate between these pill mills and legitimate prescriptions is what other alternatives are being used. Is a pill the only thing that's being used, or prescriptions being written for alternative manipulation therapies, for physical therapies, for other methodologies being used?
They're all offering the same cocktail in pill mills. Everybody gets the same thing. Yes, sir.
I'm just wondering, it kind of goes on what Mr. Carver was saying about testing. I know some actual pain management specialists that actually do drug testing with all their patients when they come to their office to make sure they're taking their pills. You know, we're not taking too much of them, whatever the situation is. And is there any possible legislation that might go into effect to make that already hack off that drug testing in order to keep getting pills?
Already there. As a matter of fact, the administrative rules that have been approved by both boards that are currently now in the legal challenge stage, so they're not actually enacted, both list in there a number of different things. Actually, addressing the management that you were talking about, the first statement that's in there, it says, for purposes of this rule, it is presumed that the prevailing standard of care for the treatment of chronic non-malignant pain is a multidisciplinary approach and is not prescription-based only. So the administrative rule already lays that out, that just prescribing pills for the management of pain is not the way we do things here in the state of Florida anymore. Additionally, in there, it talks about the requirements for those physicians practicing, including their documentation, the fact that they need to do a comprehensive history and physical examination, document medical necessity for the management of the pain, have the appropriate imaging and laboratory studies, and do drug monitoring on a regular basis. And if they're finding out that patients are not following their plan of care, they're supposed to terminate their care or at least their prescription medications. There are medication contracts between the physician and the patient. So that's all in there now. We're just waiting for it to be allowed to move forward and become part of the administrative rule.
And that'll make things more difficult for the pain clinics, the pill mills rather, because they won't be able to get 80 people in and out of the day. And some of these doctors are, they're just seeing that many people. And there's a whole thing called the midnight MRI, with a portable MRI that goes around, and because one of the things that some of these pill mills require is an MRI. It doesn't matter whether or not it shows that you have a bad knee. It's just like, here's an MRI of my knee, and I say it hurts, and that's enough. So that's part of that whole scheme. Exactly.
I believe also there's another testing in qualitative or quantitative. If you suspect someone that's overdosing themselves, is using a lot, you can take that kind of test will tell you that quick. So we do have things that we can tell. It's not a guessing game. But nobody's putting it into practice is the problem.
It's going to be required. And not only overdoses, but also looking and seeing if a person's been prescribed, several medications as part of their treatment cocktail, if you will, and then you do a random drug test and you find out that their levels are virtually zero. Then we have the other issue we talk about, which is diversion. That they're getting them and turning around and selling them for $15, $20, $40 a pill.
Exactly.
The other thing is that the law reads non-malignant pain. If you're in doubt whether your patient is malingering or not, someone like me, I'm a neuropsychologist, and when they are specializing in addictions and evaluation and pain, etc., could always send them to a neuropsychologist like myself, and we do a wide range of testing to determine whether they're malingering, how serious is their pain, etc. So there's always that possibility if you're in doubt, but you would have to find someone that specializes in that.
Yes, sir.
I'm a third-year law student, but I'm also actually being treated for a chronic pain issue. My concern is with these pill mills and things of this nature is I understand the inherent risks and the chances of use of these medications. For someone like me, though, who has used these medications responsibly, my fear is, first of all, it's been very difficult for me to get doctors to prescribe such medications, and even more difficult to get pharmacies to fill them. So I haven't had that experience. The notion that these things are just candy way in the past certainly hasn't been my experience. My concern now is that for the people who actually need these, aside from those battles, it seems like there's now this other battle in the legislature mounted by well-meaning people that are only going to hinder people who really need them from getting access. because of the other risks that are associated.
Every time we do a story, I hear from folks like you who have legitimate issues for pain, who need this medication, and who say as a result of this, just like you say, it's becoming increasingly difficult to find physicians who will treat them or look at them like they are, Kentucky drug dealers and want to get this to sell or abuse in some fashion. And I don't know what the answer is. I mean, you guys are the experts here. It is a problem, and it's unfortunate.
I think it'll get easier because, as Mr. Ferrero said, it's wild, wild west of that. There are no rules, and people are either going to be free and easy, or they're going to be scared to death. Once rules are put into place, and there's a little bit of an initial shakeout, I think it'll settle out, and people will now know exactly where they stand with the rules. And those that are prescribing appropriately, and those patients that are requiring